Welcome to HIP and CDC. You might ask me what? What is abbreviation stands for? We want to make it confusing for you guys. So deliberately, because this is what they do in Washington. They want to make it look complicated. HIP stands for Health Insurance Personalized, folks. And CDC, which is a very popular abbreviation, stands for Customer Driven Healthcare. Customer Driven Healthcare. Welcome. This is Consumer's Doctor on the behalf of Foremost Organization. I'm the volunteer. I'm helping the folks to know what's going on with the healthcare as we see it, because America has a dysfunctional healthcare system, folks. I'm passionate about straightening up this healthcare mess, so-called healthcare mess. Yes. Today's topic is larger employers like larger self-insured groups. That's the topic. Larger self-insured group. They fall under the category of ERISA law. ERISA law, which stands for Employment Retirement Income Security Act of 1974. So let's go into details. What this larger employers, we have about 120 million. Actually, there are more than that, but 120 million are insured by the employer subsidized, so-called employer subsidized groups. So employer sponsored plans. These are the employer sponsored plans. So let's go into detail what this 125 million blue collar workers have. So let's educate ourselves and see what they have. And they are under the federal law because they are mandated by the Employee Retirement Income Security Act, which is a ERISA law. Larger employers need healthcare reform more than health insurance reform, folks. They don't need health insurance reform. They already have. What they need is health care reform. Larger self-insured groups would benefit from transparency of medical service costs, medical quality standards, and tort reform to minimize the cost of defensive medicine for the doctors. Tort reform. These 120 million Americans, so-called blue-collar workers, get coverage through a large self-insured employer-sponsored plans. Employer-sponsored plans. Morning coffee. However, issues they face, and changes that would benefit larger employers are very different from the smaller, fully insured employers and purchases of individual health policies. They're quite different from the smaller employer groups. So these federal law, the large employer groups, they're quite different compared to the small employer groups. The main difference being they're regulated by the ERISA law of 1974. ERISA laws are very different from the more restrictive state and Obamacare laws that regulated smaller groups and individual policies. So Obamacare is restricted under the federal law. So the major concerns for larger employers are related to some of the stifling Obamacare regulatory restrictions placed on them. For example, larger employers hire many part-time employees and add others for seasonal needs. Obamacare requires full health insurance for employees who work more than 30 hours a week over a period of 120 days. As a result, many employers have been forced to artificially limit the hours. They are forced to limit the hours, so the employee hours are restricted because of the Obamacare. So Obamacare, when it mandated it, also penalized larger larger insured employers for plans that were considered too expensive. They penalized larger employers for plans which were considered to be very expensive. For example, many unions historically negotiated more health insurance benefits as more valuable than salary increases. Obamacare taxed in excess of 40%. This is called Cadillac tax. That's what they did. They penalized the larger employers by putting a Cadillac tax. Other issues faced by the larger employers center mostly on health care reforms needed than health insurance reform. What are the health care reforms? They include need for transparency of the medical costs, medical quality standards, tort reform to minimize excess costs for defensive medicine for facilities and doctors, both combined. Mostly doctors. Most of the tort reform is focused for the doctors because they had to do unnecessary tests to practice defensive medicine. They do unnecessary x-rays, CAT scans, MRIs just to defend themselves, so that is raising the cost by doing unnecessary tests on the folks. They don't need it. So personalized, so-called health insurance personalized, HIP, would help large employers. It is a foundation for a health insurance system, and the small employers and individuals should have the same incentives. They should have the same incentives as large employers to lower the utilization of medical services by grouping it. All smaller employers can be grouped. They should be able to participate along with the larger employers. That will lower the uninsured that will lower the uninsured, especially individual mom and pop businesses, smaller employee small businesses. They should be able to participate along with the larger employers as long they are in a group setting. Then all employers, large and small, employer groups, individuals, associations, would more effective work together on common interests to change the insurance and the medical cost barriers. There are a lot of barriers, folks, for affordable care that will incentivize the larger and smaller employers to participate so that they can get affordable care. Three issues. Three issues. Hurting smaller groups. One of the reasons we have large uninsured because most of these folks are working for small businesses. That is the engine. That is engine which drives this economy, folks. Small business. So those three issues for smaller groups and individual policies are guaranteed issue. That's number one, guarantee. Smaller insurance, smaller groups don't have that guaranteed coverage. And number two, coverage for the pre-existing conditions. And number three, single risk pool. They're all pulled into single risk, folks. That's what we have been talking about. They need to be changed to a risk fragmentation. Smaller groups, especially smaller employers. The larger employers, they can address it and negotiate with insurance companies, but smaller employers don't have that luxury unless they group together into larger employers. So those are the three issues. Guarantee. This is one good thing about the Obamacare did, which mandated guaranteed, like a mandated. They mandated. There's a difference though. Mandating, if they're, is different from people buying insurance. So they're penalized for not having insurance. So the three issues are guaranteed coverage, coverage of the pre-existing illness, and single risk pool. They need to have risk segmentation into four categories for smaller groups, like well category, at risk or acute condition category, chronic conditions category, and catastrophic category. They need to be fragmented. The larger employers don't need they don't need much of because the larger employers should be able to take care of themselves. They can negotiate with insurance companies, whereas smaller employer groups are the one they need help. Larger employer groups are generally sophisticated buyers, folks. That's the main difference. They typically have human resource departments, and human resource are schooled in healthcare laws and regulations. Staff usually have certifications, college degrees, and other diplomas related to insurance and healthcare. So they have this luxury. They also hire outside consultants, brokers to keep up to date with benefit designs, laws, regulations, and related issues. And under the ERISA, employees and family members are not individually written. So guarantee issue for larger employers, they have a guaranteed, but not for the smaller employers, folks. This is where the problem is. They're not guaranteed for smaller groups. And ERISA law mandates pre-existing conditions with minimal exclusions for limited periods, wherein smaller groups don't. So coverage is guaranteed under ERISA after 30 to 90-day waiting period. So you work basically for a large self-insured company. That's what it is for the larger employer groups. And you get guaranteed insurance, coverage of the pre-existing conditions, and employer subsidies under the large employer groups. And the other main difference between the large and small, larger employers they have their own risk pool. Risk pool is self-insured. That means employer is at a risk for the claims of the employees and the family members. Therefore, only the experience of that employer groups enters into their cost of insurance. So basically, they can do the risk fragmentation themselves. You might ask, why don't we just have ERISA laws for everyone? I'm sure that ERISA law is an unusual law. It was originally passed by Congress in 1974 to help retirement plans, folks. Later on, Supreme Court decisions expanded the flexibilities of ERISA to self-insured health plans. That's what happened. ERISA cannot easily be used because it requires to be self-insured. That means employers must assume the risk of their own claims. That's what the ERISA law states. If large claims occur from a catastrophic health event, even from a single plan member, a smaller employer could bankrupt, where larger employers can be self-insured because they have a reinsurance program, so they can take care of themselves. Larger employer groups can take care of themselves, whereas smaller employer groups can't. So in some ways, Obamacare was to provide ERISA-like protections for guaranteed issue and coverage of the pre-existing conditions for all. That's what it meant. To accomplish that goal, unfortunately, politicians and bureaucrats included too many market distortions and arbitrations. It didn't work. It didn't work. Yes, because they deliberately distorted it. And as a result, for smaller groups left in a limbo. So what did the smaller employer groups done to avoid the Obamacare and mimic the benefits and flexibilities of the larger employer subsidized groups under ERISA? You'll be amazed. You'll be amazed what the smaller groups did. These smaller groups are generally young and healthy. If they can pass a risk fragmentation test, health and they have the option of using ERISA if they have a risk fragmentation. This is very important. For the smaller groups, they need to have a risk fragmentation into well category, at risk or acute condition category, chronic conditions category, and catastrophic. They need to have for a smaller employer. That's the only way they can be they can provide the insurance. So you see, they found a legal loophole in Obamacare. They have opted to implement reinsurance program. Cleverly designed reinsurance plan can limit potential liability from single claim. So insurers now offered ERISA, self-insurance, and ERISA, so-called self-insured health insurance to groups with fewer than 10 lives. Now, insurers are offering ERISA for a smaller groups. So basically, insurance have been a little more flexible in that regard. So while these self-insured products benefit healthy and smaller groups, they do not help others. Like others with older and less healthy employees will see their premiums rise even faster as health groups opt out of Obamacare's single risk pool. Obamacare has basically is a premium based. They're not fragmented like what we see in the self-insured group. To further complicate the situation, smaller group uses self-insured option and later develops a large claims. They may be forced out of the reinsurance program. They may be forced out because then they can't re-enter Obamacare under the Obamacare's guaranteed issue mandate. This drives up the premiums for all fully insured health insurance plan. Even fully insured health insurance, this drives up the premium because of this rule. They cannot have a guaranteed coverage. So you see, politicians try to artificially control the markets, and they will always fail. Only real reform that use the power of competition and focus on consumers will succeed. Only consumers and the competition. Consumers will demand competition. As a result, only the consumers will be able to lower the cost, and personalized health insurance has been carefully designed to create a free market that will work for everyone and provide health insurance for all. That is the intent of the free market. But these politicians deliberately made it so difficult for the smaller employer groups because they could not be self-insured and they did not do risk fragmentation like in the other self-insurance under the large employer groups has. So for smaller groups, we will talk about in another episode how the smaller groups works. So the larger employer groups basically need more of a health care reform because they're self-insured. They can take the burden of large claims through a reinsurance program only larger employer groups have. Smaller employer groups don't. The reinsurance is, you need to qualify the reinsurance, only the larger employer groups can qualify. So this is the way how it works, folks. So Health insurance personalized, so-called customer-driven healthcare, personalized healthcare. You name it. You can name it in whatever. And demand control healthcare, demand control health system, consumer based patient centric system, so-called setting up personal care accounts. That's what they need for this individual and smaller, whereas larger employer groups already have it. They just need some healthcare adjustments. But other than that, the larger employer groups are able to take care of themselves under the ERISA law. But overall, they need to lower the costs of the healthcare. The only way we can lower the cost of the healthcare is by deregulation, folks. Healthcare is too overregulated. There's no doubt about it. Look at I compare healthcare to the food industry. What is so different between healthcare and food? I don't understand that. That is also fairly regulated, but why can't we take the healthcare, compare with other food industry? Is They're doing a great job. Let's deregulate and take away this burdensome regulations, which will ultimately lower the cost of healthcare for all and focus on the smaller group, especially uninsured. Focus on them and give them the certificate of guaranteed coverage, folks. This is what we need to focus. Address what is most important. Certificate of guaranteed coverage for those who are uninsured. If people don't get the health insurance, they lose exemptions when they file their taxes. As simple as that. You don't have to mandate it. Let the folks decide. Let the consumers decide. If they don't buy the health insurance, they lose the exemptions for themselves and their families. Obviously, they will have the insurance ultimately. But focus on who need the most. That's what my, you know, that's what, as a consumer's doctor, foremost organization is passionate about taking care of the lower economically impaired group, physically and mentally impaired group. These are the folks we need to focus on. Those 27 million uninsured that can be easily be taken care of. Don't go after the private health insurance. Don't go after the larger employer groups. Focus on where the attention is needed and give the opportunities of fragmenting the risk for smaller groups. That will lower the premiums, that will lower the cost. Folks, thank you for listening. It might be a little bit confusing, but I'm sure you're getting my point. What we need to do is price transparency. We need affordability, we need competition, and we need transparency. That's what we need. Thank you for listening. This is Consumers Doctor on behalf of Foremost Organization. We will see you in the next episode. Salute.